The DEA is in the process of rescheduling medical marijuana from a Schedule 1 to Schedule 3 as a controlled substance. A Schedule 1 drug is one that has a high potential for abuse and or addiction with no currently known medical use. A Schedule 2 is a high potential for abuse and leads to severe psychological or physical dependence. In that case, why are alcohol and tobacco not controlled substances? Let's talk about it. Hey everybody, it's Dr. David. I'm a board certified pediatrician in Tampa, Florida. I have a family medical clinic here. Work with a lot in my belief of freedom of choice and information needing to be gotten so that people can make the best decisions for themselves. Now, I also try to look at things from different angles in order to give the best advice that I can. And sometimes I'll come up with things I'm like, oh, I don't know that anybody's thought of these things before. As part of this, to be clear, I'm not calling for a ban of alcohol or tobacco, but I'm raising some serious questions that users should really be taking into account as to whether this is something they want to put into their bodies. Now, we're going to be talking today about the Controlled Substance Act and how the scheduling works. We're going to talk about how medical marijuana has been scheduled and why it was classified wrong in the first place, and why alcohol and tobacco fits the definition of a controlled substance. Now, the Controlled Substance Act itself, it was passed in 1970 by Congress, and it was called the Controlled Substance Act, and this was done to prevent the abuse of drugs, narcotics, and other addictive substances. But the law specifically did say that tobacco as well as alcohol were not going to be considered a controlled substance. My guess is that those are big companies with money and they were able to have their money talk, but that's just my opinion. Now, what does a Schedule 1 mean? As I said, there's no current medical use with high potential for abuse or addiction, and that's things like psilocybin, which is magic mushrooms. That's a Schedule 1, although one can make an argument, should that be a Schedule 1 now that there is medical knowledge being known about it? It's kind of an example of how the Controlled Substance Act is just not right. It's not commonly addictive. Medical medicinal mushrooms for themselves. I've actually shared a leak down here from Johns Hopkins University listing their research into the medical benefits of magic mushrooms. So then again, the psilocybin. So you can't say that there's no medical benefit to something when Johns Hopkins has an entire research branch relative to this. Now again, this is not something that I'm not recommending magic mushroom psilocybin to any of my patients. This is something that's not legal in the state of Florida. It is something that I do believe more research needs to be, and the information that's coming out of places where it's legal, such as Colorado, what it's doing for things like anxiety, PTSD, I think it really warrants a lot more research, and sounds like it could be helpful for a lot of people. Now, in terms of addictive substances themselves, since this is what it's all about, the top 6 most addictive substances for human beings, in order, are cocaine, heroin, alcohol, nicotine, barbiturates, and methamphetamine. Okay, cocaine and heroin are Schedule 1, methamphetamine and barbiturates, most of them are Schedule 2. Okay, and then of course, amongst these, the other 2 that are not listed there, again, alcohol and tobacco, but yet they are among the top 6 most addictive substances. Now, medical marijuana itself, I thought it was patently ridiculous for it to be listed as a Schedule 1, because it's been known even in the oncology world for people who have cancer and are using chemotherapy, how it can be really settling to them and let them tolerate their chemo better. But there's also many medical benefits that I've seen with my patients, such as reducing aggression in autism, controlling anxiety and depression, could be a lot very effective for pain and insomnia as well, and a lot of other benefits. And in my opinion, the feds made the proper move in removing it from a Schedule 1. I think there are people who can argue that should it be descheduled altogether, especially in light of alcohol and tobacco not being scheduled. But let's talk about those other 2. Alcohol. Okay, so first of all, the World Health Organization has declared that there's no level of alcohol consumption where it's safe to our health because the risks compared to the benefits clearly are outweighed. So the risks are way outweighing the benefits from it. Now, are there some benefits? Yeah, there are some benefits. Research has found that people who have low amount of alcohol consumption, but some actually does lower risk of diabetes. That there are several studies that actually have shown that it can lower the risk of dementia or decrease cognitive decline over time. with mild to moderate use. And also, moderate alcohol intake can reduce gallstones. So there is medical benefits there. But of course, the evidence also does suggest that mild to moderate alcohol consumption does decrease could does increase, excuse me, the breast cancer risks. A small amount will make you lose brain volume. Okay, it's well known to be again, it's a carcinogen. It's considered group 1 carcinogen, which is the highest, most dangerous group. And so damaging brain and liver exceeds the benefit. In my opinion, based upon this definition, it should be a Schedule 2 under the Controlled Substance Act. Now, in addition, tobacco. There really, I guess you could say that there's benefits to nicotine itself, because it does have stimulant abilities. It can have appetite suppression. It can increase the sense of like sensory processing of information, and it can ease tension. That's of nicotine. Okay, and of course there are nicotine gums and other things that ways that people can do it without burning it into their lungs. But what are the risks? Well known. Lung disease, cancer, both lung, colon cancer, heart disease, diabetes. Again, this should be considered a Schedule 2, if not a Schedule 1, medication as well. So, it's concerning that, that the government just doesn't look at all of these things in the same way that they should, right? And again, makes you wonder, why back in 1970s, why the alcohol and tobacco weren't on there. And obviously they were illegal for a long time, and who knows what it would have caused in terms of an upheaval amongst the population. We obviously saw how it was with prohibition back in the 20s and how well that went. And obviously, I'm guessing they just didn't want to go there again. But again, if you are a consumer of these, recognize what you are doing to your body. As far as that, people can choose to do what they want. That's totally their call. I rarely consume alcohol, several times a year, maybe at a party, wedding, bar mitzvah, something like that. And I've never smoked cigarettes in my life. And that may be the reason why people are quite surprised when I tell them that I'm 55 years old, because most people would, at my age, typically have a lot of wrinkles and other things going on, and aches and pains and stuff. And that's never been something that's been a part of what I've had. It may also be because I've been taking antioxidant supplements since I was 20 years old as well. But I do think that part of the youthfulness that I've been able to maintain is because I've never been a consumer of alcohol or tobacco. Now, if you ask me what my recommendations is, it's avoid both. All right, so that's my take on it now. Now, if you find this interesting and want to share with other people, please do. And of course, please subscribe to this channel if you want to get other videos as they come out. And if you really want to be a supportive of ours, please join us on Patreon. We do release videos there earlier. I do put some additional content there that is not normally part of that I'd be posting anywhere else. So in addition, a lot of my holistic primary care protocols that I have for my patients, they too are able to be are accessible to our Patreon members as well. So hopefully you'll join us over there. All right. Well, anyways, I hope everybody has a great day and that you learned something, and to your health. Bye-bye.